Hi, I'm Dr. Wilfredo S. Tagle, a urologist. I'm a lifetime member of the Quezon City Medical Society, a lifetime member of Philippine Medical Association. I have served as Governor, Quezon City Region for PMA, and past President of Philippine Urological Association, Philippine Academy of Medical Specialists. Welcome to our program. I will be talking about the screening of prostate cancer. But first, let me define what is cancer. Cancer in Latin term is crab or creeping ulcer. It is a swollen vein around the tumors which resembles the limbs of a crab. It is a malignant tumor of potentially unlimited growth that expands locally by invasion and systematically by metastasis. According to the Global Cancer Registry of 2020, the Philippine Cancer Statistics, we have a population of 109,581,085. But the new cases of cancer raises up to 153,751 and the death recorded was 92,606. That is the problem of cancer here in the Philippines. I would like to show you and explain to you the early signs of cancer in general. Number one, if you have an unexplained weight loss, nangangayayat ng walang dahilan, mostly more than 20% of your usual weight. Number two is bleeding or pagdurugo. Number three, discoloration or pamumutla. Then, a mass or bukol na makikita nyo kung saan parte ng ating katawan. Pwede rin number 5, non-healing wound, mga sugat sa parte ng ating katawan na kahit gamutin, kahit katakot-takot na nagamot ang ininom, hindi pa rin gumagaling. Number 6, hoarseness of voice, yung bagbabago ang iyong boses. Then, change in bowel habits, yung lumiliit, nagiging parang tain ng kambing, ang laki ng mga dumi, at laging constipated or hindi regular ang pagdumi. Pwede rin, change in urinary habits, or minsan umiihi ng may dugo, or ihi ng ihi, or painful urination. And number 9 is pain. Masakit sa katawan, sa likod, or kung saan man malapit sa location ng cancer. And lastly, for number 10, pwede rin itong mag-present as itchiness or pangangati sa katawan. Prostate cancer is the only cancer that are seen in dog and in men. Usually, that's why the dog are said to be the man's best friend because it is the only animal that develops prostate cancer. And the same with the man, it develops prostate cancer on their late years of life. So, we will talk about the prostate. Prostate is a secondary sexual organ of the males. Lalaki lang po ang meron nito. It is located just below the urinary bladder. So, ang problema nito, pag lumalaki, dumadaan doon, dumadaloy ang ihi, and ang pag-ihi ang usually affected. Doon natin makikita ang problema sa prostate. During the development, at birth, prostate is just very small, around 1 gram, kasi laki lang ng mani. Then, as we grow old, during adolescence, The prostate gland doubles its weight at a maximum of 20 grams. That would be normal weight of an adult prostate, which is around the size of siniguelas. At the age of 40, the prostate cancer again increases its size, slowly increasing even until death without limit. It could be as big as santol or even Bangkok na santol. In the public toilet, you would observe that those men with prostate problems usually remains longer in urination and their problem are said to have prostatism. The most common problems of the prostate are number 1, benign prostatic hyperplasia. Number 2 is prostatitis or infection of the prostate. And number 3 is the prostate cancer. Usually, the common lower urinary tract symptoms are number 1, weak urine stream. Number 2, intermittent urination. Number 3, straining during urination. And number 4, incomplete emptying of the bladder. Then later on, when the prostate becomes bigger, it produces obstructive symptoms. Now, you will have frequent urination, urgency, and nocturia. The prostate cancer risk factors are number 1, age, 2, race and ethnicity, number 3, geography or the location where you came from, number 4, family history, number 5, metabolic syndrome, and other dietary factors. So for the AIDS, rarely it occurs in men less than 40 years old. After 40 years old or 50 years old and above, it rises rapidly in number. And for 65 and above, 6 out of 10 men usually develop prostate cancer. For race and ethnicity, there are less prostate cancer seen in Asians and Japanese race people, and more cases of prostate cancer for African Americans. For family history, it runs within the family. It has a double risk if it is present within the family. If you have a brother who develops prostate cancer, you have a 7.7% chance of developing prostate cancer. If you have a father who has prostate cancer, you have a 5.5% chance of developing prostate cancer. It is also associated with an early onset of developing prostate cancer by 6 to 7 years. For geography or location, it is less common in Asia, Africa, Central America, and South America, but common in North America, Northwestern Europe, Australia, and the Caribbean region. Prostate cancer is also commonly seen in men who have a metabolic syndrome. For diabetic patients, metformin users have a decreased risk of developing prostate cancer, but still it is under clinical trial. For patients with high cholesterol, it is not associated with the risk of developing prostate cancers, and those patients taking statins have no preventive effect on the development of prostate cancer. Other risk factors for development of prostate cancer are diet, obesity, smoking, exposure to chemicals, inflammation or infection of the prostate, sexually transmitted infections, post-vasectomy, and exposure to UV lights and radiations. In diagnosing prostate cancer, you have several simple methods. Number one is the digital rectal examination, wherein you will know if the prostate is enlarged, the prostate is tender, or there are nodules within the prostate. Number two is prostate-specific antigen, or the PSA. And number three is a prostate ultrasound, either through abdominal, transrectal, or perineal. And, of course, if there are high suspicion of a prostate nodule or prostate cancer, we can do biopsy. What are the treatment options? Usually, our elderly population in males are techie. They could just grab their cell phones and look for it at Google. They could also access Google or information through internet wherever they are located in our country. For an early stage prostate cancer, you could do watchful waiting. Number two, assess if the symptoms improve or deteriorate. If the symptoms are improving, you can continue your watchful waiting. And if the age of the patient, you think that the life expectancy is not more than 10 to 15 years, you can continue your watchful waiting. You don't have to be aggressive. And lastly, if the character of the tumor is slow growing, then you can do watchful waiting. For treatment of obstructive prostate, we can give alpha-adrenergic blockers like tamsulosin, terazosin, doxazosin, alfuzosin, and silodosin. If the condition persisted, other treatment options for prostate cancer is number one, radical prostatectomy. We could also do radiation or brachytherapy or external beam radiation. We can do hormonal manipulation or hormonal therapy and other treatment if the patient develops complications. For prevention, prostate cancer could be prevented, number one, with early diagnosis and early treatment. Once you diagnose a prostate cancer at an early stage and you remove everything, it is as good as the patient did not develop prostate cancer. Another one, for diet, of course, fruits, soya and other legumes, green leafy vegetables or green tea, tomatoes, lycopenes, cruciferous vegetables, and lastly, spermine. Spermine is an enzyme found in the male semen. So it is better to have a regular sexual activity for males 65 and above so that they will prevent prostate cancer development. Thank you very much. Maraming salamat po.